Toxicities are mainly urinary toxicities, acute toxicities, but also long-term toxicities. And of course, because the proximity of the rectum to the prostate, we see rectal toxicities as well. Those can be radiation proctitis, bleeding, etc. We have a number of ways to minimize those. We start to use also now the hydrogel that can be placed between the rectum and the prostate to improve the distance or increase the distance between the two areas and therefore minimize toxicity. If it does happen and patient have some bleeding, then it depends how severe it is. Usually a conservative approach is preferable over any surgical intervention. Sometimes if a patient has a lot of bleeding, then they might need to have some coagulation of a bleeding vein or artery, something like that. But typically over time things become better. Patients who are on anticoagulation usually have somewhat higher risk with that. That's what we see in our practice. Some, for instance, impotence that can happen, they usually have a decline over time and they're usually not reversible, but they can be treatable with some different options like PDE5 inhibitors, vacuum pumps, or self-injections. And we usually counsel the patient on the options for that too.